Hello, I'm Dr. Brandt Gibson, and tonight I want to talk to you about another common problem that we have with the foot and the ankle. It is lateral ankle sprain. So when you are talking to someone, they say, I just sprained my ankle, they're usually talking about a lateral ankle sprain. So I'm going to answer these 4 questions about the lateral ankle sprain as well. So number 1, what is a lateral ankle sprain? So when it comes to the ankle, you've got 2 bones of the ankle. You got the fibula and the tibia. You have the deltoid ligament on the medial side, or on the inside of the foot, and you have the lateral ankle ligaments, which include the anterior talofibular ligament, the posterior talofibular ligament, and the calcaneofibular ligament. When you sprain them, you're going to sprain the anterior, then the calcaneofibular, and then the posterior in that order. So as you get more severe in the sprains, you get a 1st degree, 2nd degree, 3rd degree sprains where you're actually doing it in order. And because of that, the most common sprains basically are the lateral ankle sprains. And what happens is you'll literally roll your ankle and you end up spraining that. So that's what a lateral ankle sprain is. The question is, why does it happen? There are really three common reasons why we actually see a lateral ankle sprain. One is you are an individual that sits in a supinated position. So you actually kind of sit on the outside of your ankle and you easily twist it and roll it over, and that can sprain an ankle. Number 2 is one of the common motions as we're moving is rolling. Say you step in a hole or you're injured or something like that, you roll, and that's the weaker side of the ligaments. These ligaments on the inside, or the deltoid ligament, is much stronger than the lateral ankle ligaments, so you end up rolling that way. And the 3rd is if you have a weakness or a problem with the peroneal tendons where they don't react fast enough, you start to roll out, and before they react, you've sprained your ankle. So since ligaments are usually weaker than bone, that's the first thing usually it will come. Usually you'll injure the ligaments or the bone, and usually the ligaments are more common. So number 3, how do you treat this at home? So if you have a lateral ankle sprain, so you say, okay, I just rolled my ankle, what are the things you can do? The easiest way to remember this is rest. So rest basically means you need to stay off it. You need to limit what you're doing. Ice on it, especially right after it happens, is really important. It decreases the swelling, decreases the pain, and allows it to start to recover. Compression, so wrapping it. The best kinds of wraps are like an ACE wrap type thing, or even an ankle brace that's snug, because the ankle brace will also limit the motion. And then elevation, the blood flow will be increased as long as the extremity is below the heart. One of the ways that the body actually heals is injuries is it will actually increase the blood flow to that area, but that causes significant swelling, increases your pain. So rest, ice, compression, and elevation. Elevation is above the heart. So if you do those, that's a good place to start. Number 2 is you want to say, okay, I need to manage this by limiting re-injury. So what you want to stop that motion. So usually if you're going to get an ankle brace, you want a brace that actually allows this motion, but takes away the side-to-side motion. And so if you have just an elastic ankle brace, most of the time they're not going to do enough. You need something that actually has a pretty sturdy side so that can limit that motion. And the 4th is, when should you be seeing a doctor? The truth is, if you have a pretty good or a really good ankle sprain, it is a good idea to be evaluated to make sure you don't have any additional injuries. You want to make sure you don't have any fractures to the fibula, you don't have any fractures to the styloid process of the 5th metatarsal, you don't have any fractures to the calcaneal beak. The idea is there's areas where you're going to look. You also are looking for a high ankle sprain to say, okay, is it a bigger deal? Are there more additional injuries? So you get evaluated to make sure that's the case and to make sure you're being treated correctly, because there are things that can be done in a doctor's office that can't be done when you're doing it at home. So the idea is you want to look for other options, other things that you can do to make sure that you have the care and the treatment that you need. This is Dr. Brandt Gibson, and this is your Podiatry Tips Day 161. I apologize for that. We kind of knocked over the tripod, but either way, the point is, if you have an ankle sprain, there are things you can do at home,